Let's talk about the coronavirus recovery and now the ability to get the vaccine to younger people and more of them. Just this afternoon, the FDA expanded the emergency use authorization for the Pfizer vaccine. Now adolescents between the ages of 12 and 15 can get the shot. Until now, Pfizer had been approved for those 16 years and older. The CDC says there have been 1.5 million cases of COVID-19 between the ages of 11 and 17.
And joining us now is Director of Pediatrics with Dignity Northridge Hospital, Dr. Richard Kang. Thank you for your time today. I imagine this is something you've heard a lot from parents about just in the months and weeks leading up to this decision. What are you hearing from families about the possibility of giving this vaccine to this age group?
Well, there's many thoughts. A lot of parents, the main question is if my child is healthy and children are less likely to get really sick from the coronavirus, why should they get the vaccine? And as a pediatrician and someone who believes in population health, I think it's important in this recovery process. You know, the children ages 12 to 15 represent 5% of our population, and it just gets us one step closer to that, normalcy that we've been searching for over a year now since the pandemic began.
So which kids should get the vaccine?
I would recommend it for all children. The study showed that it was 100% efficacy with everyone in the study tolerated the vaccine well. So I would recommend it to all children, and especially those with pre-existing conditions such as those who have obesity, diabetes, and some immunocompromised situations like those going through chemotherapy for cancer.
And Dr. Kang, you mentioned that it's well tolerated. Are the side effects similar to those that we've seen in older teens and adults?
Yes, the side effect profile was pretty much the same across all age groups and all the studies that Pfizer did. So, and that includes this recent study for the 12 to 15-year-olds.
So we've been talking a lot here on the news about vaccine hesitancy and the drop-off by adults here. So kids under the age of 18, they need a parental or consent from an adult. I'm thinking if mom and dad aren't getting the vaccine, eligible children aren't going to get the vaccine as well. Talk about the impact of that.
So, and I think there's twofold to the vaccine. So one is obviously you're trying to protect yourself from the coronavirus and COVID-19. The second, as important, is to prevent the spread of the virus. And the more people that are vaccinated in this country, the less spread there will be, and the less chance for new variants to form. Again, the more, I think it was estimated 80% of the population would have to be vaccinated for us to achieve herd immunity. And that, because there are adults that are not willing to get the vaccine, children will need to get the vaccine to reach that level.
All right, Dr. Richard Kang, we appreciate your time here this afternoon.
All right, thank you.